morning, everyone. Hello, everyone. We're in Mexico City at the Cuídate clinics with Pavel, medical manager of the network of clinics within the framework of World Diabetes Day. In a couple of days, we'll be interviewing leaders, managers, and specialists in diabetes management. We're at a critical time for this disease, which has always been prevalent, but has become more so now with the confinement that came with the pandemic. It's forced us to rethink the healthcare system and its response and mobility implications of patients. Thanks, Bilal, for the space and for the work that you do. And well, maybe you'd like to tell us a little bit of what you do in Cuídate clinics. What's your healthcare approach? We find it very interesting how you approach patient management.
Yes, of course. As precisely derived from the pandemic and some other situations, right now we have all our attention focused on the southern unit, the Taxqueña Clinic, which coincidentally we're located in right now. We are a system with 600 registered patients and where more than 25,000 consultations have already been given. We are a system that already has experience and above all, information. It is something that we need to achieve. It's crucial to collect solid data, real data to analyze in order to improve patient care. Clínicas Cuídate is characterized and is distinguished by being a comprehensive care system based on low-cost education. It is finally 3 flags of care in the Cuídate system. The Cuídate system, being a comprehensive care system, has a multidisciplinary team of experts in diabetes, doctors, nutritionists, diabetes educators, nurses. We partner with retinography services, podiatry. That is, if something has to be clear to the patient with diabetes, it is that a multidisciplinary team is required to care for him or her. There really is no single patient care. A doctor, no matter how expert he or she may be on the subject, is far from being able to provide comprehensive care themselves to a patient with a disease this complex. What we do in the Cuídate system is to combine comprehensive care and education with obviously digital platforms, which greatly favor us with care and monitoring, which is very important, as well as collected data.
Yes, that was the next thing I wanted to ask you. How is technology helping and or allowing that comprehensive approach in an efficient, optimal, and personalized way? We've also spoken many times about the approach that digital data allows treatments to be personalized in a massive way.
Personalized is a key word. Speaking of diabetes, when patients arrive here, we tell them there is no universal treatment. Each case is individualized. We are going to make a custom treatment for you. The first thing the patient has to know is that the collection of solid data, quality data, allows us to give a highly individualized treatment, which is always a challenge. International treatment guidelines exist. The key detail is that each case is attended by individualizing those guides, those international treatment regulations. As for the digital tools, well, we have the support of SocialDiabetes, obviously. The application allows the patient to collect data in a friendly way. We are in an epidemiological transition in terms of age groups. And this is where half of the patients who are fairly young, relatively, are typically familiar with their way around a smartphone or computer, which they end finding very useful. To our elderly patients, who are a large portion, more than a half are in fact elderly patients, may not have been too familiar with this technology, but we are beginning to see more involvement with technology and it's helped us expand communication. Beyond thinking of a service where we are available 24 hours, it's somewhat complex in a first level care unit. What it allows us is to not miss any information. First of all, it allows information not to escape our hands. It allows the patient, which is usually very common, that at least in cities, the vast majority of people have access to a device like this, an intelligent cell phone unit, to collect data in a simple way that allows the patient in the moment in which to get to an appointment the other information. The more information we have, the safer and more effective decisions we are going to make. That is the first guideline. The following also, as because of the support on your part, thank you very much, Maria, an electronic file was personalized for us, which we also have personalized, as is. Speaking of personalizing social diabetes, we have personalized an electronic file that allows us to have, obviously, the data of the patients combined with the application. The electronic file allows us to the Cuídate system, which is multi-modular. For a patient who comes to an appointment, will invest between 2 to 3 hours of his time in going through 5 modules from reception to modules of nursing, nutrition, and medicine. The file also allows that in real time the information can be visualized and the doctor can even make decisions ahead of time. It saves time and it allows data to be collected without being lost and allows decisions to be anticipated.
I'm very glad that it's helping you.
Yes, of course, and you continue to give us maintenance, and obviously that also supports us to continue moving forward. Like all treatments, things can be improved and can be perfected.
Our relationship with all of you during this pandemic has been very special because there was a challenge, right? On behalf of all involved to maintain that telematic assistance. What has it meant for the Cuídate clinics and for you as a team to maintain that level of care, to keep patients connected at such a critical moment?
If we had thought, what an interesting question. If we had thought about the pandemic 20 years ago, for example, where the contact was a phone call, and I don't know if everyone had a phone. If we had thought that the only means of contact would be a phone call, not so much a text message, like similar issues, it would have been a lot more complicated. Tremendously more complicated. They say digital media has helped us to get closer. I've heard that they bring the far closer and the close ones away, but neither here nor there. That's an entirely different issue. Technology definitely brings us closer to the patient. I can really imagine how difficult it would have been to get close to patients in a time when the protocol is for everyone to be apart, without having digital tools.
Yes, I've been told that you have not closed, not interrupted.
Never. We haven't closed a single day.
You've really maintained a real level of care.
From the first day of the pandemic, we stood our ground. Rather, we obviously implemented security measures, which we still maintain. They have not had to relax because the measures are really simple. Using a mask in closed places, keeping hands clean, and keeping the place clean is more than enough. These are 3 very powerful measures to prevent infections.
Very well. And lastly, how do you see the future? We always see the future through technology, but how do you see the face of diabetes in the near future? How do you see that it's going to revolutionize treatments, or how will medical assistance evolve and what role will technology play in it? How do you see yourself in this change?
Yes, of course. The pandemic function as crises do. They generate or accelerate changes. They are catalysts for change. The change was already present. Finally having telemedicine, it was visualized. Having remote assistance, it was visualized, and there were finally tools that were not used a lot because people adhere to the traditional, and human beings have a natural resistance to change. That is finally a great truth. However, the advantages it represents were felt very, very late in the pandemic. Practically, what the pandemic accelerated was the ability to understand that although telemedicine, and at least in the medium term, will not replace face-to-face assistance. Since we have to do a foot check, an arterial Doppler, an electrocardiogram, check an injury, these are things that cannot be done remotely. I think that the debate that is current is that telemedicine is a substitute for face-to-face assessment. I doubt it, but it is an excellent add-on for a hybrid system. They are not in a fight with each other. Face-to-face care is not at odds with telemedicine. It is complemented through it. Obviously, there was a lot of resistance to almost any change. However, people notice the benefits of, or that there will be a patient who has already come. A first-time patient to a telemedicine consultation, no. A first-time patient for diabetes, no. We can't glimpse it right now, but a patient who has already come and requires a follow-up of the treatment that we gave it, we will saturate the waiting room. There are no more appointments. Let's see what your question is, and we'll finally communicate definitely. It is a powerful complementary tool that brings us closer to patients. It does not replace the face-to-face assessment. Rather, it complements it with many benefits.
Very well. Pavel, it's been a pleasure to see you after so long.
A very long time since we saw each other through screens and calls. It is a pleasure to see you.
Thank you for the conversation.
My pleasure.